WCON 1170 Radio and Starvision Cable Channel 16 are pleased to present We Should Know, hosted by J.W. Simmons, an upbeat, informative look at people, places, and issues facing our community. This education-based analysis of issues will remain positive and informative as we consider closely what we should know.
Ladies and gentlemen, welcome back. The name of the show is We Should Know. I want to thank Nicole for that introduction she gives us each and every week. I also want to thank you for your comments on our show last week. Representative Dr. Laibel was with us, and we talked about a number of the issues facing the legislative body in Raleigh, upcoming and present issues that may or may not be affecting you and your life on a daily basis. Again, thank Dr. Bell for being with us and his continued support of the program and keeping our listeners and his constituency informed. As always, we want to thank all of those people that continue to listen and continue to make comments. We encourage you to go to Gmail, that's weshouldknow.edu@gmail.com. Continue to give us your suggestions, comments, and otherwise observations in regards to issues and subjects that we address. Today we're talking about something that's vitally important to everyone. We're talking about Medicaid, Medicare. We are fortunate to have Kim Reid with us. Kim, thank you for being here. You're the cooperative extension agent here in Clinton. You deal with family and consumer sciences. You've been on the show before. We were fortunate to have one of our sponsors, Jimmy Matthews, to bring you on to talk about specific things related to Medicaid and prescription drugs. As a result of that, we had a number of folks to say, well, I'd like to know more about Medicaid and more about Medicare. I've heard the names, understand a little bit about it, but they want a little more in-depth on it. So to open this today, I want to kind of give you an opportunity to talk about Kim Reid and remind us about your background and so we can kind of get a little familiarity with you as we go into this conversation.
Okay, my name is Kim Reid, and I was raised in Sampson County, moved to Wayne County, went to college at East Carolina University, and I did an internship in Wayne County at Cooperative Extension, and that internship turned into a job. And then I had an opportunity to get promoted to take a job here in Sampson County, and here I am.
Well, it's been I'm sure if it's like a lot of folks I talk to, this thing called career and life goes fast.
It does.
To kind of open this and give folks a perspective, a number of research folks out there indicate that it's costing taxpayers $1 trillion annually, and these are rounded numbers, $1 trillion annually, that it's the single greatest threat to the stability of the budget in the country is when you look at Medicare, Medicaid. Now, the term entitlement is often used. One quote that I will throw on the table comes to us and says, unless reforms are in place, entitlements will consume all tax revenues before today's 25-year-olds are eligible for Medicare. So when we talk about Medicare and Medicaid, Kim, it seems that it's kind of a lump sum conversation, but it's two distinct programs, correct?
Correct. It is.
Let's talk about, first of all, what Medicare is. That's more of a senior citizen kind of thing, isn't it?
Well, it's not just our seniors. The majority are 65 or older, but it also covers people that are disabled. So there's some people that are disabled and they're 23 years old. And so there's some people, they can be 65 or younger that have Medicare. So it's just not for 65 and older. If you're disabled, you're also eligible for Medicare if you're disabled.
I think sometimes we think of it being more of a senior 65 or older because that's where a huge chunk of the budget is for Medicare is in that area. What kind of circumstances, and again generally, because obviously we don't want you to divulge personal information, but generally what kinds of programs do you see folks less than 65 that are dealing with Medicare as a supplement to them?
One would be if someone has kidney failure and they have to be on dialysis, and that could be at any age. I mean, there was a 23-year-old young man who came in who was dealing with kidney failure. He was on dialysis, and he's on Medicare because he's disabled and not able to work. So just because you're young, there could be a situation where you get sick, or a situation happen where you're not able to work and you're disabled and you're not able to work, and you could qualify to get services like Medicare to help you with your the cost of medicine, because we do know that it's very expensive. So that's one of the reasons why it was put in place in 1965, is to help people with health issues that happens, and that's one of the reasons why it was put in place.
We often refer to Medicare as an entitlement. Medicare, in a sense, I guess, is something that folks pay for over time. I'm sure your check and everybody else that receives a check out there from an organization or company they work with, there's a certain amount of money that comes out of that goes into paying Medicare.
Right.
So explain how that works, and is it something over time that's appreciating or depreciating?
Well, from over time is the way, with the high cost of insurance and medicine and all of those different things. There's a lot of talk about that it's not going to be around forever, and they're trying to find ways. But it was put in place for us to have insurance when you retire, when you get 65, to have it in place. But of course, as the years, it was in place in 1965, and we're 2013, and the cost of medicine and just in general, going in the hospital and all that, is just skyrocketing, and so that's a concern of how to continue to keep that up.
When you speak to groups, and I know you speak to a lot of groups and organizations and inform them on this particular subject, on Medicare and Medicaid. I want to get into Medicaid in a few minutes. But when you're talking about Medicare, what are some of the things that you would say to folks today that maybe are in their 20s and they've just started their career, as you look at your experience and understanding of what Medicare is? What would you say to them about preparing themselves for that 20, 30-year leap ahead in time?
I would definitely say to make sure that they start saving now, because we do not know the future. We're hoping that it's going to be around. We need it to be around, because there are going to be situation or certain situation or individual that may not be insured, and if that's not around, that's going to be a big expense on them. And so instead of not having that safety net, not having something in place, this could be something that you could start thinking of now. Do I need to start saving for myself, just in case, and not just solely depend on one particular, putting all your eggs in one basket. So it's nice to just have some eggs in some other basket, just in case, because we do not know.
Right. Now, there are, I understand there are policies, insurance policies for long-term care and those kinds of things. Are they such that the average person in today's market, are they affordable, and is it something that everybody should look at in their 20s and 30s? Because I really want folks to understand, as they listen to this program today, this is not something that you just need to think about just before you're 60 or 65. You need to be thinking about this from 20
Right.
on up.
Right, because definitely need to start thinking about it now. Long-term health care is very expensive, and so you definitely need to start saving now. Again, you don't want to put all your eggs, well, they're taking out, money out of my my check, and I'm going to have it in the future. That's not guaranteed. And so you definitely need to not just put it all in just one place, and just start a savings, because long-term health care is very expensive. Even if you're employed by your employer, if you get cancer, they don't cover all of the expense. And so there's some people, some employers are offering cancer insurance. And so you just never know as far as health costs, your health in general. And so if you have the opportunity to have some other resources in place to cover that, that's going to be beneficial to you, because again, the cost is continually to rise each year.
Are there limitations on Medicare, and you mentioned those folks that may not be seniors that are not drawing Medicare but may need the service of Medicare? Are there limits on what they can receive or not receive? Does it narrow the road for them if they're on Medicare versus somebody that has saved resources or has assets at 30 years old, and they have to, as for example that you used was the dialysis, that say a person has personal assets, do they get better care than somebody that's on Medicare?
Definitely, if you have the resource, again, the prices is going to be very expensive, but if they have resources, if you have the savings, it's going to help them as well. But with you having Medicare, it's going to help with that cost. So if you don't have a savings, but you are disabled, you're going to be able to have quality health care. You're going to be able to go wherever you would need to go to get the services. But if you say that you didn't qualify and you're still not 100% able to work, but you was able to save up some money to offset the cost of insurance, that would also be helpful. So I mean, again, if you have a savings, that's going to be helpful because it's going to help you.
The Medicare has a limitation. There's an eligibility issue with Medicare. So a person with a certain amount of savings or assets, they would be limited in how much Medicare they could receive. Is that
That's
correct?
what Medicaid.
That would be with
Medicaid.
Medicaid.
Medicare is Medicare. The difference between Medicare and Medicaid is the income. With Medicare, you're going to be eligible if you're 65 or older, or if you're disabled.
Okay.
And you have to go through the whole process of seeing, do you qualify for disability, and if you qualify, then you automatically get Medicare. But you have to wait 24 months before you get health insurance. So you can start receiving your Social Security check for disability, but you still have to wait 24 months before you're eligible for your Medicare health insurance. So again, if you start saving now, that's 2 years without insurance. If you have resources available, you don't have to go up 2 years without having insurance. So again, it's important to save.
Okay. We're going to take our first break and come back and talk about this subject a little bit more. Ladies and gentlemen, we're talking with Kim Reid. We're talking about Medicare and Medicaid. We'll be back in a moment. We encourage you to call a friend and stay tuned for We Should Know. Ladies and gentlemen, welcome back. The name of the show is We Should Know. We encourage you to call a friend. We're talking about Medicare and Medicaid today, how it impacts your life, what you may know about it, what you thought may be correct or not correct. We have a specialist with us today that literally goes about teaching this subject to different people and informing folks about Medicare and particularly Medicaid. One of the things, Kim, I want to talk about, and you did a good job, I think, in the beginning as we opened this discussion, but I want to just kind of start our conversation around a quote, actually a piece of an abstract from the Heritage Foundation. And the abstract says, the quickly rising cost of Medicare and Medicaid are a burden on all Americans. The traditional program's fee-for-service payment, in which doctors and hospitals receive a fixed payment for each procedure and services, encourages an increase in the volume of services requested, which increases excessive spending. And it goes further to say the system also does not ensure quality, which contributes to unnecessary costs and higher spending as well. There's a lot of hits that's being taken by Medicare, Medicaid, and I'm sure you get confronted with these kinds of things all the time. But when we step back and look at the dynamic of what these programs are, they're basically a national or a government insurance program. So the big question, I think, before we get into this Medicare, Medicaid and the difference between the two is a fail-safe system. I mean, could we actually as a society drive by and see people standing beside the road with all kinds of problems, diseases and other things that children and various other people that just simply do not have means to have services done? I mean, I think that's, for those people that says, well, do away with the whole system and let everybody look after themselves, that extreme, then you've got others to the other extreme that maybe feels as government should should be more contributing to people. So where do we fall there, and what does the extreme say to you?
I think that the most important thing is that it's just definitely have to be a balance, because we can't continue to spend and the money is, we're spending but not putting anything back in, and so it's not going to be around forever if we're not being mindful of how it's being spent. So, but we don't want to have, like you were describing, children not having the care and medicine that they need and all of those different things. So it definitely has to be a balance, and so that's what we're hoping that, over the years, that everyone on both sides come together and have a balance that, is going to be something that's going to be beneficial for everyone, where you are thinking about the cost of it, but you are still, we are still making sure that as a society we're looking for people that are unfortunate and they're not able to pay for quality health insurance.
I think the term that's used is low asset people that literally, for whatever reason, has not been able to obtain the necessary financial wealth to maintain a long-term cost, either in a extreme situation, whether it's a child or a young adult.
Right.
Well, let's talk about a minute the differences between Medicare and Medicaid, and try to get in folks' minds at least a general idea. And I know we're not going to be able, we don't have time to get into a huge amount of detail because you're talking college coursework to even get into the details. But Medicare and Medicaid, similar sounding words, have maybe some similarities but distinct differences in their application and purpose.
Okay. With Medicare, again, it's a federally funded program, and it was enacted for people 65 or older, or for people that are 65 and younger that are disabled. With Medicaid, they were both, Medicaid and Medicare, they were both put in place in 1965, and the difference is with Medicaid, it has to do with the target audience is for low income families or young adults, and there is a guideline to see who qualifies for that. For an example, if you're single, and this is currently their guidelines, if you're single and make $951 or less, you qualify for Medicaid.
For Medicaid.
For Medicaid, and you can't have, a lot of different properties and different things like that. So if that is all your income in or less, then you would qualify for Medicaid. If you're married and together y'all bring in $1,281 and you don't have a lot of different real estate or assets, and this is all that your income is, then that would qualify a person or a couple to have Medicaid.
Now, is this per month when we're talking?
Per month.
So 900 is a threshold, 1,200 is another threshold when you look at those numbers. And when you talk about assets, folks would probably say, well, how about my car? I've got a car, but I rent a house. Does a car considered assets, or?
It doesn't include your house or the land that your house is on, or the one car that you're driving. So if you have one car that you're driving, or if you're married, both of you can have two cars. But if you inherit a bunch of different acres of land, then they're going to consider that, because they know that you can sell that and have an income, and so that you would not be eligible for Medicaid. And so they look at it very carefully to make sure that
compliance is there.
Correct.
And I think that's a key issue too, is a lot of folks, and believe it or not, I've had people since you were on some months ago with Jimmy, I've had a lot of folks would ask me, well, you need to get somebody to talk about the details of this. So that another detailed question that has come up is, what is the investigatory process? If person A and person B are married, they live in whatever location in the country or the city, and they apply. They fill out an application, correct? So once they apply, is there a investigatory process? Does somebody actually go through that paperwork, look at records and documents to verify what is on that application true?
Yes. And of course, one of the things that they're gonna, one way that they verify a lot of information is, you know, the computers and their Social Security. And so by putting that in, they're gonna find a lot of information. So whatever you're putting on that paper, they'll be able to cross-reference and make sure that what you're putting up there is
accurate.
Accurate.
When you indicate and you said like a vehicle, each person can own a vehicle, and together the family can have a house, obviously, and live in that house. Is there an amount of value? For example, can two people own a couple of S500 Mercedes and live in a 5,000 room house, and all of a sudden go, look, you know, I only make $1,200 a month, so I need to, you know, I need Medicaid. Is that? I mean, that sounds absurd, but I'm just putting that, you know, as an extreme.
What you're saying. Yeah. Correct. And that is a question that, you know, we can. That's not a answer that I can. A question that I can answer, but I do have the number to social services, so you know that's something that you can call. But you know they do have certain guidelines. The guidelines that I have, it just gives us, you know, a single person how much you're supposed to have, a married person how much you can have.
Okay.
So
Well, and I think those are the kinds of questions you've probably had that question before. People look at you and go, well, can you do so and so and so, and what's the minimum amount, and what do they look at documentation and asset for income? I mean, obviously, the extreme situation I just gave you, the I'm sure the utility bill will be over $1,200 a month. But those are questions that folks often will ask me, or I get emails and you know they say, well, how about ask this question, or how about find out about this? So I've got to put that on the table as a reality.
That's fine. And you know, one of the things that you're required if you're applying for Medicaid, you have to bring in, you know, your utility bill. You have to bring in, you know, to make sure you're living where you're supposed to be living, and they do a thorough job and investigate and make sure that, you know, what you're putting down is accurate. So, you know, of course they're using the computers, but they're also, you know, calling and checking and doing a lot of detailed information to make sure it's accurate. And you have to bring a lot of papers to make sure that what you're saying is true.
Well, and it's important too, I think, to make sure folks, as we're talking about this, knows that there's an element of federal law violation if you do falsely identify some of this information.
And they are cracking down and making sure that, you know, people are not anything as far as fraud, you know, so they're doing a big campaign. I just did, I went to at least 5 different senior sites talking about Medicare fraud and making sure that they're reading their Medicare summary notice and making sure that, you know, they got that surgery on that particular day and that's the doctor that they went to see. And so, and just in that and in general, everybody's trying to make sure that they're on patrol and they're, you know, looking out for that because people are concerned. You know, it's our taxpayers' money going into this system, and we want to make sure that, you know, it's used what it's meant for.
And of course, there's a number of nationally and state level news programs that have covered some of the things you just alluded to that talks about some of the horrific hundreds of thousands of dollars of fraud that has gone on by falsification of documents. When you go about doing presentations and talking with groups on this, do you get feedback? I mean, after the presentation, does somebody come up to you and go, hey, how about so-and-so, and get these do you get a lot of feedback from folks concerned about this thing?
I do get a lot of feedback, but it's a lot. The feedback I get is very positive, and they say, "I'm so glad you talked about this because I do get my notice in the mail, and I just throw it in the garbage. And now I'm going to take the time and make sure my name and my Medicare ID is up there is correct. I'm going to look at the you're showing me how to read my summary to make sure that the information is right, and that's what we want them to do because we know that there's some people out there banking on people not to look at it. So they can get away with, fraudulent behavior.
Because it's kind of like stealing identity. Folks will tend to steal these identities and leverage it to their benefit.
Right. They can, take your identity and get a surgery that their family member needs or whatever. And so that who does not have insurance. And so it's up to that person to make sure that they're opening their mail and investigating on their own. And it's simple things that I can do.
Well, Kim, we're going to take another break. Time's going fast, folks. Tune in. We're talking with Kim Reid. We're talking about Medicare and Medicaid and its impact not only on you but society. Ladies and gentlemen, welcome back. The name of the show is We Should Know. We want to thank all of those folks who are listening to us out there. We want to particularly give a shout out to those folks at WCLN Radio, Don Smith, the Boogie Shoes Radio Network with Robert Stroud on Saturday afternoon. Always gives us a positive mention. We appreciate Robert and everything he does for the radio. Tommy the Fly, we want to mention Tommy as well. He also lets folks know what's going on and what the show is going to be. Also, that gang on the morning show, the L-Man, Nolan Z, and Grandpa, all of you guys, we want to give you a shout out and thank you for mentioning the show. Today we're talking about Medicare and Medicaid. We're talking with Kim Reid. Kim is a Family and Consumer Sciences Extension Agent here in Sampson County. Graduate of East Carolina, Pirate fan, I suspect. We'll give a little shout out for the Pirates. Kim, when we're talking about Medicare and Medicaid, we're kind of differentiating between the two, what Medicare is, Medicaid is. The general synopsis is that typically Medicare is something that you file for as an insurance once you reach the applicable age of 60 or whatever. However, there is a nuance in that if you do have some kind of particular ailment that you can be on Medicare without being 65. So it does cover both, but the majority of Medicare assets is for those senior population folks. So that moves us to Medicaid and what Medicaid is and maybe what is not. But one study indicated that 1/3 of children, over half, 59% of low-income children are insured through Medicaid and a program called SHIP. What is that in the and how does that impact us, and what should we know about that? In fact, in February 2011, there was a record 90% of children, 8 million children, that remained uninsured. So we're looking at not only people that's on it now, right, but a huge population that just simply doesn't have insurance that has the potential of having to tap in to this Medicaid resource.
With Medicaid, and you're mentioning children being uninsured, and again, we can reference that to more detailed answer to that question would be contacting social services. And a lot of times people are unaware if their children qualify, and again, they have to meet a certain guideline and all those different things. So yes, we do have children that are uninsured, but a lot of times people are not taking the time to see if they are eligible. And I do have the number to our local social services, and you can contact them. And what you need to do when you call them is let them know, I need information on Medicare for children or adult Medicaid.
Those programs are available, and oftentimes there's a dire need out there, right, and folks may not know that. So if you've got a telephone number that they can call, not only for this particular program, but for just to reach you for additional information, let's give them that number now. Okay.
My number is 910-592-7161, and I can help you with anything pertaining to Medicare and Medicare Part D. And my specialty is the Medicare Part D, and that the Medicare Part D is prescription drug plan. Once you get your Medicare card, if you don't have any other insurance, if you're not retiring with insurance, then you would need to add the Part D, because your Medicare card, just the A and B, does not cover the drug you're getting your prescription. So I'm the person that you would contact if you need to add on a Part D.
I like your visual there. That gives everybody, at least that's watching us on TV, an opportunity to copy that number.
Right, I thought that would be helpful.
Yeah, absolutely, very helpful. And that number will also get you, and you can maybe direct them to other resources they need if you're not particularly involved in that.
Correct.
Now, you mentioned contacting social service about children. What's that number?
The information for social services, and this is Medicare questions for adult, Medicaid questions, or if you have questions about Medicaid and qualification for adults or children, you can call this number, push 0, and you'll get an operator and say, I would like to talk to someone with Medicaid for children or Medicaid, adult Medicaid, and so you're going to get. They're going to connect you with someone that will be able to help you to say, let's see if you qualify. Let's sit down, and this is what you're going to need to bring, and let's make an appointment.
Okay.
So this is a helpful
Okay.
number.
I hope everybody got those numbers down. We'll try to mention them again before we go off air today as well. So Kim, we're into Medicaid, and we're talking about Medicaid and its impact, and how folks, you just gave the information out, how they go about applying, how they go about getting information, the impact of those programs, the tremendous cost, and how those costs are going up. One thing clear up for us as well, and this is a question. These are just questions comes up, and people will, again, they'll call me or they'll ask me, and I always like to ask the experts on this. A person that is not a citizen of the United States, are they eligible for any of these programs?
They, if they're not a U.S. citizen, but their children could be. So if you may see someone that they may not be a U.S. citizen if they were not born here, but their children could qualify because their children were born here.
Right.
So
if the child is born in this country, they're automatically eligible for these federal programs.
Correct. But that parent may not be.
Okay. And I think that's important as we look at and this is interesting too, I think that our listeners are very well aware of, all of these programs have an impact on each other. So when we talk about this program or we talk about immigration itself has a huge impact dependent upon what happens with that program, because we're looking at, by some estimates, of 12 plus million additional population of folks that may need these kinds of services. And that's a subjective kind of response, because obviously we don't have any objective information, but that's something that folks needs to be aware of, and it is often brought to my attention as well. Right. So let's move, again, a question that comes up is the question about money and retirement. Someone is retired, they have all their insurance, maybe they have 2 or 3 insurance policies, and they say, well, look, I've reached that point, and I'm either going to I need to go ahead and do what I need to do as far as my Social Security, because I've contributed for ever how many years, 30, 40 years, some people even longer. And so I believe I need to engage my Social Security. So they contact Social Security, and they're probably told, in fact, I've had several people tell me this, they were told up front, well, when you draw your Social Security, you have to accept this, and we might as well call it, I guess, a national insurance program called Medicare. Right. And you have to take that. And they say, well, I don't want it because I've got 2 insurance policies. I'm sorry. You've got to take, if you get your Social Security. Now, the only way you can stay away from that is not draw your Social Security, which is a little bit troublesome, because I've had folks to tell me this too, and you've heard this, a lot of these things, we've talked about off air, so I know you've heard all these things. Folks will say, well, it's going to cost me up to sometimes $200+ out of my Social Security check. So for example, somebody says my Social Security check is $1,500. Well, instead of drawing my $1,500 Social Security, I've got to take taxes out. Now I've got to take $200 or $300 of insurance out. Now I'm down to $1,000 or $1,100. Is that correct? And why, if you've got insurance, would you have to accept and pay for government insurance?
Okay, and that's a big question.
Yeah, no, it is. And I just stretched it. I mean,
we'll take it one piece at a time. Okay, so if you're drawing your Social Security check, the Part B in Medicare, we have A and B. That Part B is not free. Now that has to also do with income. Excuse me. The premium is $104.90. But if you are a single person and you make more than $85,000, then your Part B premium could be more than $140, $104.90. If you're married and you make over $170,000 together, that premium could be up. So it start off with $104. If you're not in that category, your premium for Part B will be $104.90. But if you fall in this bracket, it could be $200 or $300.
But it's income driven.
It's income driven. So if you make if you have, if your income is more, if you're single and making $85,000, your premium is going to be more, even though you have 2 or 3 insurance.
And even if you're married, there's that number
increases,
married, but it's still not significant.
Increases.
You're looking at a little over 100,000 if you're married.
Right.
And two professionals that are married
Correct.
easily is probably going to hit that threshold.
Right. And the other part, you were saying that a lot of people don't understand because they're retiring or they have, state health plan. They're retiring from the state, and so we have the state health plan. But also, for years, you've been paying into your Medicare card, paying for your Medicare card. That's what FICA is for.
Yeah, absolutely.
It's paying towards that, and so that's why you have to take it. It's tied to your Social Security check, and so that's one of the reasons why it's taken out. But also with the state health plan or any employer group health plan, those your insurance companies, they know that you're turning 65. They know you're required to get that insurance, and your Medicare becomes your primary card. So all the other insurance is secondary, and so they're going to put the first cost. They're going to push it on Medicare, and then they'll come and cover what Medicare doesn't, because Medicare covers 80%, and then they'll come and cover the rest of that cost.
And it's these kinds of leverages that we look at that's really not only that, but other kinds of things, but this particular one that may have an impact as we look at that $1 trillion a year and how it increases, because the insurance folks say, great, let's put this first because we don't want to spend our money.
Right. And so it has that whole balance where they know that, they know that Medicare is your primary. When a lot of people don't, they're not thinking that. They say, well, my state health plan, that's my primary, and it's really not.
We're going to take another break. We're talking with Kim Reid. We're talking about Medicare and Medicaid, trying to understand this huge bureaucratic formula here. Stay with us. We'll be back. Ladies and gentlemen, welcome back. The name of the show is We Should Know. If you're driving down the road listening to us on WCLN Radio, we've got some information. We're going to give you audibly some numbers here. A while ago, we gave out some numbers that you could call and get additional information as it relates to Medicare and Medicaid. We're going to try to give you those numbers audibly, at least to make sure that if we don't want you to be writing and driving, but if you are listening to the radio, certainly we want you to be able to write these numbers down. We'll try to give them to you a couple of times. Kim Reid is with us, and she is the Family and Consumer Sciences Extension Agent right here in Sampson County. Kim, you know a lot about the stuff we're talking about, Medicare, Medicaid. We've done a lot of conversation about it. Let's give folks those numbers again. For the number for social services is 592-7131. Of course, that's all area code 910, both of these numbers. You can call that number at 592-7131 and talk about qualification for Medicaid services or any Medicaid question. Now, the number for you is 592-7161 for Kim Reid, and just ask for Kim Reid. They know her very well. I've called down there several times and they put me right through. Sometimes I get your voicemail, but sometimes I get you as well because you're out in the community trying to give folks information about this very timely subject. So hopefully you got those numbers if you're listening to us on WCLN 1170 AM radio, and if you are watching us on TV, we gave you a visual of that so you could look at it and maybe freeze frame it a minute if you need to write those numbers down. That's additional information. We encourage you to call those numbers because certainly we're not going to cover everything today. Kim, we were talking about trying to get folks a little general information, if you will, about Medicare and Medicaid, and we talked about a bit about eligibility and when you enroll or when you go to draw your Social Security, there's a certain amount going to come out depending on whether you take Part A, B, or if you're in Part D. So let's talk about the Part A and B and what the difference between those two are as it relates to this whole genre of things that we talk about funding for. And this is really a form of national health care. We just think about the National Health Care Plan coming in effect in 2010 as being the national health care insurance, but this has been around since 1965.
Right. And that's not going to affect Medicare at all. A lot of people say, how's that going to affect us? It's not. It's going to be, we've been around for years. It's already a health insurance. So That's one of the questions.
Okay.
A lot of people are saying, how is this going to affect Medicare? It's not. Okay. It's going to be still the same. And with Medicare Part A, that stands for the hospital. So when you go to the hospital, that's how, that's what Part A is covering. And Part A is free. If you put 40 quarters, if you work 40 quarters, then your Part A is free. If you worked 30 quarters or less, then you may have a premium for Part A.
Okay.
And so the 40 quarters, I think, is equivalent to like 10 years.
Mm-hmm.
If you work 10 years or more, then you'll have that Part A free. But if you did not work at least 10 years, then you may have a cost for your Part A.
So the housewife that's the wife of a farmer in the county, and she hadn't gone out and worked in the public, but she's worked diligently, at the home and raising children and all those kinds of things, she may not qualify for the Part A, or there may be a supplement required.
But that's a great question. But she's going to qualify because she can get Medicare underneath her husband's Social Security number. So that's a great question. Okay. So there was,
in this county and surrounding counties in the east here, I'm sure there's a lot of folks fit in that category.
Right. We have, husbands that stay home and the women work, or the men work, and the women stay at home.
Absolutely.
They still would be able to have Medicare, and they can draw that, insurance from their husband's Social Security or their wife's Social Security numbers.
But they have to be legally married to qualify.
They're married to that, to their spouse, and when they get 65, they will be able to get Medicare.
So if we can just remember that Part A primarily pertains to hospital and the interrelationship with the hospital and the patient. Okay, right. Part B.
Part B is when you go to your doctor's visits. That Part B is not free, and that's where the $104.90 come in. We were talking that is taken from your Social Security check, or if you make $85,000 and you're single, it may be $200. If you're married and make $170,000, your premium may be more.
Okay, so, and that was married if you make how much?
If you're married and make $170,000.
$170,000 plus. Okay.
Mm-hmm. Or if you're single and make $85,000.
Okay.
Or more.
Okay. All right. So when we look at that, as you said, for Medicare, that's important for us to think about. For Medicare Part D, now that's been around not quite as long as the Part A and Part B in Medicare, but it's very important for folks to know, and we addressed that when you were here some months ago with Jimmy Matthews, again with Matthews Pharmacy, and talked about that. But let's mention that again and its impact and why people should know about that.
Medicare Part D was put into place in 2005 or 7, and the whole purpose of that is to give it was broken up into different companies, and it's an opportunity for people to put plans together and for consumers to see, well, I can get the same medicine here, but I can get it at a cheaper price. So it's really trying to give people more choices and see if they can get it, quality medicine and get it at a reasonable rate. And so there's a variety of different programs, plans out there, and that's what we're looking for as when we're looking at your Part D. Now, there's a lot of questions that come up that people ask me all the time. Well, why is my neighbor paying $12 and I have to pay $200 for my medicine?
Absolutely.
But one of the things that you have to be aware about is that neighbor may be on all generics and you're taking all brands. Mm-hmm. So that's gonna, it all depends on what type of medicine you're taking, and your health concerns or issues that you may have may be totally different from your neighbors.
Well, Kim, are doctors kind of getting dialed in to understand this now, and when they make prescriptions, give folks prescriptions, do they look at generics and apply those as often as they can, because sometimes the newer drugs are 3 and 4 times or even more.
And I think the doctors are, but I think it's also up to the patient to, advocate for themselves, to, just to make sure, do you have a generic? Can I start with that first? Mm-hmm. And if that's not helping me, maybe you can move to the brand. So I think that the doctors are, making an effort, but again, it's always up to that patient to make sure, let's see if we can start with a generic, because the brand medicines, they are costly. And there's some generics, that people use and say, well, wow, this is really helping me. I was taking the brand and I switched and I don't see a difference. So ultimately, it's up to you to, make sure that you're monitoring and, see if you can get, cut that cost, that high cost of that medical bill.
Okay.
So,
well, as we look at that, what drives a person to say, I do not want the generic, I want the brand? I mean, is there some psychological thing that people think that the ingredients are different in the generic? Or?
Well, when you're talking about brand, it's going to be more expensive, so that means a higher quality. And so, I know some people, they're going to go for the brand and be like, well, I've tried the generic and that, I just felt horrible. I felt miserable on that, and I'm just going to sacrifice and just pay that high cost. So it just, there is a difference, and and there's sometimes people that can take it, and everybody's different.
Yeah.
Some people can take something, a generic, and they're fine. Some people can take that generic and they have a lot of different side effects.
Because there are maybe a little bit different ingredients or the balance in the ingredients.
Correct. And so, it's just different for everyone, because everybody's health situation is totally different from the next.
We've covered a lot of things in our conversation today, and before we get to the point we need to kind of go to close out, I want to speak to this, and this is just something that's out there. You hear it a lot. Folks have talked about it. It's been wrestled with on a lot of the TV shows, and it's called the donut hole. Okay. And of course, when people hear that, they either think glazed or stuffed or whatever, but there's something different when we're talking about the donut hole as it relates to insurance, and particularly Medicare and Medicaid. What is the donut hole, and what do we need to know about that?
Well, we were just talking about generics and brands. If you are on a lot of brand medication and your medication is a tier 1, 2, and 3, and so the tier 1, 2, and 3 are brand medications, but they also put them in categories. The higher that tier, the more that medicine is going to cost. And so the donut hole is where for the first 6 months, your Part D or your state health plan, well, not the state health plan, but your Part D is going to help you with that cost of that expensive medicine. So the first 6 months, your medicine's not going to be that high. But the next 4 or 5 months, you're going to be in a donut hole because of that cost of that brand medicine. So that's what the donut hole is.
So that's just that kind of state of limbo that you are either going to have to pay for it yourself. Correct. Because there's not going to be any subsistence there.
Correct.
Even from your insurance or from your Medicare and Medicaid.
Correct. And then in the state health plan, I want to make a correction. The state health plan typically is not, you're not going to get in a donut hole. You may have some few medicines that, may be a little bit more expensive, but you're not going to get in the donut hole if you're in a state health plan. But with the Part D, you could, because of how many brand medications that you're on. And again, it goes back to, if you're 25, you need to start saving now, because you could still have insurance and could get in a donut hole and you're paying $500 or $600 for 4 or 5 months to pay for your medicine. Or you can, you're 25 years old right now, but you can be disabled at 30 and have to wait 2 years for health insurance. So it's a good idea to start saving now.
We're coming to the end of the show. Quick wrap up. I'll give you 30 seconds. Anything you want to mention?
Okay, I want to make sure that if you have any questions about Medicare Part D, you can contact me at 910-592-7161. And if I'm not in the office, another number that you can call is the SHIP hotline, and that number is 1-800-443-9354. 1-800-443-9354. You will talk to a live person, and any questions you have, they will be able to answer.
Well, again, we want to thank you for being with us. Ladies and gentlemen, we've been talking with Kim Reid. We talked about Social Security. We've talked about that impact in your life. We look forward to hearing from you, your comments, your suggestions, and we look forward to seeing you again next week on the radio.
Thank you for tuning in to this week's episode of We Should Know with host J.W. Simmons. If you have a question or comment regarding this or any episode, please send your email questions and or comments to jwsimmonsedu@gmail.com. And remember to tune in every Tuesday afternoon beginning at 2:30 for another informative episode of We Should Know.